about 5 other people. Yeah. You that football a lot. And so the last couple years have been a lot of fun. This morning I'd like to. Okay, Kim, do you need me to move? Okay.
Turn this part
back just a little bit. Perfect, just like that. That's great. Perfect.
You are the camera woman. This morning I'd like to start with just kind of a little story. I want to tell you about Mr. Jones. I'm using a fake name there, but Mr. Jones's family got a call at about 4 o'clock one afternoon that he had been outside in the Memphis weather cutting his yard and he collapsed. Mr. Jones is now in ICU, we'll say at Baptist. And family is all gathered around the hospital bed. His wife is holding his hand. His adult children are standing nearby. The physician enters and says, we need to make some decisions about his care. The room changes, like the tension, you can feel it. Right? One child says, well, Dad would have never wanted to live like this on machines. Another one says, well, how can you say that? We have to do everything possible. A third one says, Mom, you give up on him. Do you hear those words, up on him? And then his sweet little wife sitting there, she's exhausted, she's heartbroken, she's scared, and she whispers, I don't know what I need to do. I don't know what he would have wanted. You know, the biggest thing, and I hear these stories over and over and over. As Mary Lou shared, I have been in hospice for 25 years. Prior to my hospice start, worked in a couple of nursing facilities, long-term care facilities in Memphis. So my adult life has been with scenarios very similar to this one. And, but especially in my hospice journey, over and over and over, we see dynamics in families that are so clouded, and not by malintent. You've got one child who's scared to death of losing Dad. You've got another one that's scared to death that she's going to disappoint Dad because Dad would have wanted XYZ. You've got a wife who wants to please these kids, and she doesn't want to feel guilty about a decision she makes. What can we do about that? What can we do to prevent that scenario? And that's why I'm here today. What was it? No, I mean, that's why I'm here today, though, is we can not prevent the unexpected, not prevent the crises, but hopefully prevent the challenge of putting that guilt and those decisions on our family members. We can direct our care if we do it in advance. Do you mind going ahead for me, Tim? Thank you. So we're going to talk about advanced care planning today. Now, what is advanced care planning? Anybody? Lynn, I know you can answer that. Give us some examples.
Advanced care planning, in short, has to do with putting your wishes somewhere where somebody can grab them. Advanced directive says, this is what I want for my life. This is what I want at the end of life. This is what I want my family to. Advanced directive, that's in short.
She could have taught this, Tim. I think we should have Lynn up here. I like this little snippet that I took off of Google or something. I don't know. Because it does give us about advanced directives talk about your future health care decisions. It talks about who could be a decision maker for you when you can't make decisions for yourself. It talks about your goals. It talks about what kind of medical treatment you're okay with or not okay with. So I don't know about you all, but often what I hear from families and from patients is that I couldn't afford to do that. I could not afford to hire an attorney to do the legal documents for my advanced directive. What I'm here to tell you today is that is not true. That is a fallacy. And I don't mean that in a disrespect way, because there are situations where you want to employ someone who does that professionally, and a lawyer oftentimes, or legal aid. But the state of Tennessee in 2017, I believe, and I want to tell you all correctly, but the laws changed. And a group of people from it, it's really actually somebody that worked for Baptist Hospice was on this board, went to Capitol Hill, and they said, this isn't working. Like, we have to broaden the regulatory support, the laws for individuals to make their own decisions. And then they formed a commission, and together they made the document that I'm going to talk about today. So this, do you mind going ahead, Tim? Everything I'm going to talk about today, I want you to have a resource to and access to. If you go to Tennessee.gov, you're going to just search healthcare decision making, and you will get, go ahead again, see this page. On Tennessee.gov, you will find the forms, you will find everything I share, an explanation where you can reference. We don't have an excuse, I'm including myself. We do not have an excuse not to do this ahead of time for our families and for those that we love. Y'all, none of us wants to think about us being in that scenario, but it could be any of us at any time. And we're all on that trajectory at some point. So when you leave today, I'm going to give you a paper copy of the form that we're going to look at, but I also want you to be able to access it. And I told my husband this morning, and you all who are in P&A have heard me, I have done one. He has not. We are going to do these together this weekend. And so coming together today, we need to leave here and we need to be challenged to go and do that with our loved ones.
Amen.
One of the things that I may forget to say later, so I'm going to say it now, is when you have completed an advanced care plan, you need to share that with others. So imagine that sweet little wife in our scenario. What if she knew that there was an advanced care plan and she, nope, your daddy never wanted XYZ, but those 3 kids don't know it. She's still dealing with tension in that turmoil. All right. Next slide, please, sir. All right, I'm going to pass out a form because I want you all to be able to see it. Thank you, Mary Lou. You want me to give some to the other side, or are you good? No, okay. This is the free form that you saw linked through Tennessee.gov. So you can go to it, you can print it yourself. I print them on green paper or colored paper. I'm going to tell you so that when you go into your file cabinet or into your fire safe, you can get it. Because all the legal documents in your fire safe are white, right? They're on photocopy paper. I recommend that if you want to copy it, you run them on colored paper so you can find them when you need them easily. You mind going ahead, Tim? So when you, I'll talk through the form as we go. I'll probably give you bits and pieces, and then where we can just review some frequently asked questions, okay? But this care planning is our opportunity to define 2 things. Number 1, what quality of life looks like for us. And number 2, if we do not feel like the definition of quality of life for us is we feel like it's no longer met, then what kind of care would I want? This opportunity to find that out. So I want to look at section. It also, as Lynn shared, as our slide shared earlier, allows us to say, this is a person in my circle I trust to make decisions for me. We know that as the power of attorney for healthcare, which is a legal document that is typically done with the help of an attorney and is wonderful to do if you have the resources to do that. But for those who don't, State of Tennessee recognizes on this form you electing an agent in advance to be your healthcare decision maker should the time come. Here's the key. I'm going to use some words that you are not able to make decisions for yourself. Or let's look at section 1, look at part 1. And if you'll look at the sentence that starts with, when effective, you get to say, I either want this person to make decisions for me when I no longer can myself, or they can at any time. So, for example, if I've been put to sleep for surgery and my husband is standing there and I have given him authority to do that, even though I may still be of capacity to make decisions for myself when I awaken, I have given him authority to do that regardless. Now, notice this form allows us to choose, number one, an agent, and number two, an alternate agent. So what happens if Jonathan and I, that's my husband, Jonathan and I are in a car accident together and he was an agent? You want to have an emergent backup individual. And it does specify very clearly on this form that in the event that the above person unable or unwilling, then I defer to the secondary agent. So I would caution you, and this is one of those times I'm going to tell you, I'm going to caution you the 25 years of hospice background. Make somebody you trust make decisions that are your choices, and that you've had a conversation and you've conversed about that. Because look at that room that we started in that ICU room. So if we picked one child, she didn't want to lose daddy and she was going to do anything she could. And while we understand that grief and that love because she loves him dearly, what if she said, I don't want to live like this? So you got to make sure that somebody who really understands your goals of care and who is served in that capacity. Okay, section 1. Section 2. Here is where we're going to define what quality of life is to us. If any one of these are answered yes, we are going to trigger later into this next section. So let's look at it. Okay. So if I become totally aware of people or surroundings with very little chance of ever waking up, do I consider equality of life or not? If I become totally unaware of the people or surroundings around me, what is that? 7 minutes. Thank you. That's best, right? If I become in a permanently confused state, I'm unable to remember, understand, or make decisions. I do not recognize loved ones are around me. Is that quality of life or not for me? If I'm no longer able to communicate, y'all, this is a hard one for me because I'm such a talker. I'm no longer able to communicate with my loved ones, and I have to depend on them for my activities of daily living. They have to feed me. They have to help me get dressed. They have to help me walk. Or if I have an end-stage illness. Now, so if I've said, yeah, to me, these are not quality of life. I don't want to live should this happen to me. It's going to trigger then what level of care do I want when I have determined that quality of life is no longer in effect for me. So if you look at the next section, it says indicate your wishes for treatment. If my quality of life becomes unacceptable to me as indicated by one or more of the above marked no, then my condition is irreversible, I direct that medically appropriate treatment be provided as follows. This is where you get to your wishes. This is where you get to say CPR. No, I don't want to be on life support. Yes, I want IV feedings or peg tube feedings, artificial nourishment. Y'all, we get to spell it out. And look, this cost us nothing. It is a form that you do with your loved ones. Let's talk about how you make it official, okay? Since my time is ticking. On part three, this is where you can put anything that is specific to you and valuable to you. And I always jokingly share, this is where you would put that you want to have Baptist Trinity Hospice if the time comes. I'm halfway kidding, okay? This is where you would list those kind of things. So for example, if your family member had already died at the Baptist Hospice House and you know that that's what you want at that time, you would put those things here. And you know, I'm gonna have to get better glasses, Joe. No, I saw that. Also, you could list your funeral plans here. You could reference them. You can tell them where they are, where they're located. Also, Genesis body donation. If you're going to do any kind of UT or Genesis or full body or organ, list those things here. And finally, on section 5, how do you make it an official document? The form has to be witnessed by 2 adults who both of them may not be your agent in any capacity. So they cannot be the person who you listed at the top to be your decision maker. And then secondly, they don't need to be related to you. They don't need to be in your circle. Now, the form only requires that of one. I'm going to tell you that I have seen battles over that before. I'm going to recommend that neither of them be related to you. And their contact information must be on there in case we ever have to reach out to those individuals for validity. All right. The other thing is oftentimes families will say, well, but I didn't have a notary. I want you to look at the very bottom part of the form. A notary is not required. Now, does it help? Does it resonate that it is an official document? Yes. And if you have access to a notary to validate those signatures and everything, great. But it is not required. So y'all, we don't really have an excuse as to why not to do this in advance. I'm going to go quicker. I'm going to go quicker in, and I just knocked down somebody's phone. There's on the website on Tennessee.gov, you can get these answers, but there is a frequently asked questions section on Tennessee.gov. I just want to cover 1 or 2 things on here. Number 1, there's my date. It is May 9th, 2017 that the laws changed in Tennessee. So if you have created an advance directive, either one with an attorney previously or even one now, can I change my decisions as life progresses? Absolutely. You just need to make sure you communicate to individuals, hey, I know I made Amanda my power of attorney, but you know, Amanda, her life has changed and I have changed my mind. Effective today, I have a new one. And the date supersedes the previous one, okay? Then another question that is on the frequently asked questions that I wanted to point out, and I think we really did cover this already, and that is that notarization is not absolute. It helps, it supports it, but it is not absolute. Y'all, as I stop and end, and if you have any questions, I'll be happy to answer them. It's free. It's accessible. It is legal in the state of Tennessee. Most states honor it with reciprocity. There are states that have different advance directive laws. And so there's a chance that it may not be honored, but most states try to because it is a legal document in the state of Tennessee and you completed it in the state of Tennessee. I know that was really quick. Any questions? Yes, sir.
Tanya, I was going to ask, how do you handle the disbursement of these? Say if you've got a couple of people, of course you let them aware, but also how far you say extend it out, say to children, etc.
I would say your immediate family, so spouse and children, like you said, for sure. If you have a place that you keep all of your legal documents, ours is a fire safe. You want an original in there. I will say that your PCP absolutely should have it, your primary care physician, because they're the ones who should be advocating for you should something happen that you end up in the hospital. And then finally, anytime you're admitted into a hospital, produce it. And here's the why. They upload that into your electronic medical record. So Baptist Hospital System, for example, even though I had surgery 5 years ago at Baptist Hospital, any advance directive I provided them then would still trigger every time I'm hospitalized. So you always want to produce it on any kind of clinical encounter. And if you go to a BMG, a Baptist Medical Group doc, it's also going to be in the EMR. So see, anytime you can provide it to your PCP, it's important. Same thing with Methodist Medical Group. It's going to be in their system.
I have a question. Where all do you need file directives?
So anytime you change, you want to make sure that you have communicated that to your medical providers first and foremost, your family member. And I would even put in that legal document place for Mansfield is my fire safe. I would take one and I would. So it's very clear that that one is no longer in.
What about your insurance companies?
As I think that I don't think you can oversaturate. That I think that's the
Like
important thing.
Janelle, she's got my insurance, I would give it to her.
It's not necessary because I'm not.
Making the medical.
But if I know that you don't have family, I know there's a crisis, I'm gonna be in touch.
Now, you definitely want those agents staff. I didn't clearly state that. So if Lynn and Mary Lou were my two agents, they would absolutely need copies of those because they may need to produce them.
No, that's right.
It's been trying.
Yeah, I have trust, your local trust I did back 16 years ago, we did a lot of this, but you said a lost change, is that something I need to update?
No, they will still honor any legal documents that you did previously.
Okay.
This, now, the way the law changed is now it says that there were just 2 forms that the state of Tennessee recognized. Now there's 5. They just broadened it.
This is.
Oh, I can add something too. Anybody needs to notarize, my office has a notary, so you're 5 free and I'll do notarize for you.